Tansy, I want to thank you for taking the time to view this video of our healthcare delivery in Norway House. I want to thank all those that have worked hard to put this together so that we can get the benefit of seeing the things that we're doing here in Norway House. We're very pleased and we're very proud of our people who have pursued professions in the healthcare field. We have our own lab tech, we have our own x-ray tech, we have our own doctor, we have our nurses that are working in our health facility. The challenge we have is as we grow our capacity, we have a challenge of replacing this facility, which is 64 years old. It's the oldest healthcare facility in Canada. And so that is what we're challenged with. For those that may not know, Norway House is the 12th largest community in the province of Manitoba, not meaning 12th largest First Nation, but 12th largest community, period. And we're the 5th fastest growing community in the province of Manitoba. And I want to commend Councillor Gilbert Fredette for taking on the health portfolio and working with all those that are part of the health system here in Norway House. We're proud to share this with you. Please enjoy the video.
Tansy Gilbert Fredette Nhcn, Councillor and Deputy Chief of the Norway House Cree Nation. I'm very proud to hold the health portfolio for Norway House. I'd like to speak a little bit of where we were, where we are today, and where we're heading in the future regarding health for our Cree Nation. As you know, we had a balance at one time, living off the land and our traditional medicines, and as First Nations people, we were successful in maintaining our way of life. But after the Canadian government implemented hospitals, it took us away from that. And now you see today there's a high rate of diabetes and other health problems that come with losing that traditional way. Trying to better ourselves within mainstream Canadian society, I think that the partnerships that we have created in the last few years with the provincial and federal governments is going to help us obtain a better health service for the Norway House Cree Nation in the future. And it's all about building capacity from within with the Norway House Cree Nation in regarding health.
The Norway House Health Division is one of the largest federally funded programs in the country. We employ over 150 community members in Norway House. Our mandate and our goal is to deliver the best community-based health programs and services that we can. And we strive to deliver the same level of services in Norway House that any Manitoban anywhere else would receive. There are several components to the program. One key component is the primary care clinic, which provides services to over 100 patients per day.
This includes clinic services, so Monday to Friday, 9 to 5, patients coming for appointments, as well as providing emergency services. So we have always one physician on call providing emergency service overnight as well as on the weekends. The unique thing about working outside the city in a rural or northern region like Norway House is that the family doctors we're really the only ones on the ground 24 hours a day, 7 days a week. So we don't have that immediate access to specialists. So that means we have to have a bit of a broader skill set than a physician that might be working in the city and only doing that clinic practice and not providing emergency service or obstetrics service. So we're the ones that are providing treatment and stabilizing patients until they can receive that specialty care.
It's one of the largest primary care clinics in northern Manitoba. And it's also one of the largest teaching centers through the University of Manitoba Faculty of Medicine Rural Residency Program.
Almost all of the current physicians in Norway House have trained through this program. So they've gained the skills to work in contexts such as Norway House and other Northern First Nations communities and are choosing that practice and because they want to work with communities in the north. This training program continues to train medical students from their first year of training to their last year of training, as well as these family medicine residents. And at this point, we have a full complement of physicians for what we're funded for. And this training program is ensuring that that will continue.
Another department that we have is the Public Health Department, which has some of the highest immunization rates of any public health program anywhere in Canada.
My name is Flora Simpson. I'm nurse in charge for Public Health, Norway House. Being a public health nurse, we do home visits in the communities and we don't diagnose. But we do see almost all the kids here in the community. We do have a young population, almost 60% that are under the age of 18. We do see a lot of kids coming in through our vaccination clinics, our well baby clinics.
They also do a lot of outreach, working with Frontier School Division to go into the schools to provide public health education and outreach to the students.
One of the things we're doing that's been ongoing for the past year and is going to be starting for the next school year is a teen clinic. This was started by the midwife in the community. It's now been taken over by the physicians. So once a month during the school year, we have 2 physicians, one male and one female, who go to the school to offer a teen clinic. So it's a drop-in for any of the teens there who want to be able to have that connection while they're at school. So it makes it easier for them to gain access.
We also have a very large home and community care program, which services almost 150 clients in Norway House. As part of the program mandate, we also service the home care needs of 32 special needs children that are part of that program as well. One thing that sets us apart, I think, from some other communities is the fact that we have a community-owned, operated retail pharmacy operation in Norway House. The pharmacy not only services the 8,000 community members that live in Norway House Cree Nation, it also services the needs of the federally owned and operated hospital in Norway House. So we have a contract in place with Health Canada to provide pharmacy services, and that provides a tremendous support to the hospital and the needs of the hospital. The pharmacy also has a contract in place with Pinawachi Personal Care Home. And as part of our standards, we have to have a pharmacy services provider. So Norway House Pharmacy also plays a vital role in delivering services to the personal care home as well. TAP, or the Treatment Access Program, provides transportation services for patients to and from their appointments. So we have a fleet of vehicles in Winnipeg and a fleet of vehicles in Norway House. In Norway House, the program provides transportation to patients when they need to get to and from their appointments at the primary care clinic, or if they need to access any other health service like pharmacy services, or if they need to get to the public health office. In addition to that, the fleet of vehicles in Norway House also provides transportation services for patients that are going to dialysis appointments in Thompson 3 times a week. That's a component that we're not funded for, but we choose to provide that service to our community members to ensure that they get to and from their dialysis appointments when they need to.
We provide rides for them on Perimeter Airlines if they require air travel, or even medevac transfers.
And then we have the fleet of vehicles in Winnipeg that also provides transportation services to any Norway House community members that either live in Winnipeg or are here for medical appointments. Then we provide all of those transportation services for the community members.
How they would access this program for external is they have to go get referred by clinic or the hospital. The referrals come from there, and then once we receive them in our office, we contact the person saying you have an appointment at this date, how are you going? And then they tell us, okay, bus. Or if they tell us I'm taking my own vehicle, we prepare to travel. And then on the other end, that's where we have to accommodate them. They let us know if they're gonna stay on their own, or we have our own boarding home in Winnipeg.
Several years ago, the Cree Nation made a decision to invest in a large medical boarding home facility here in Winnipeg. Over the last 12 months, we've invested over $1 million in renovating that facility. The result of that is we can now provide accommodations to 74 patients per night. Because we are one of the largest communities in Manitoba, we have a large number of patients that end up in Winnipeg for services. And oftentimes they're here for anywhere from 1 night to 3 or 4 months to attend medical appointments or to obtain dialysis services. So instead of having our community members stay in different hotels across the city, through this investment, they're able to stay amongst community members at the Norway House boarding home facility. And we provide the accommodations and meals when they're there. We also provide other supports for community members when they're in Winnipeg. So if some of them end up becoming permanent residents of Winnipeg because they have to access dialysis services in Winnipeg on a full-time basis, then we help them with that transition. We help when they need to apply for income assistance, or if they need to apply for old age security, or if they need to obtain home care services through the Winnipeg Regional Health Authority. We help with that transition.
3 years ago, my wife ended up with dialysis, her kidney failure, and at least here I see people from Norway House because they come here and they stay here, and so it's a lot better than being somewhere else where you don't know anybody. So that's why we decided to just stay here till we get kicked out eventually. It's been good, I've been treated pretty good here by the landlords, and the band is the landlord here, like chief and council, and they're really pretty good with us anyway.
We've also invested in a full-time patient advocate that works at 333 Maryland. Her job is to help community members with that transition when they have to move from Norway House to Winnipeg.
As a patient advocate, I provide support services to clients, both short and long term, including counseling. I assist them with medical terminologies and I translate. I also provide support to try and find affordable housing for all clients that unfortunately have to relocate for medical reasons. When people have to relocate from, the reserve into the city, there's jurisdictional issues that arise, whereas federal government provides services for on reserve when they transition to the provincial services. And it's a long process, it's challenging for the people. Some of them it's a culture shock, when they have to relocate. They have a lot of challenges, they have loneliness. And unfortunately, these services are not there in Norway House for them and have to relocate to the city.
One key focus of the Norway House Health Division is to incorporate traditional healing methods. Our community wellness program plays a vital role in that. We utilize the services of traditional healers where and when we can. We don't lose sight of the fact that traditional healing methods need to be a key component when we deliver health and wellness services in Norway House.
Nhcn is a really good example. We identified a service gap in terms of delivery of prenatal care. It's a community-based program, but more importantly, it's culturally based. We wanted this program because it was so important for this community, for it to be sustainable. And I think that being culturally based was one of the ways that we could sustain it.
The program was needed to develop a way of providing prenatal care, postpartum care that was culturally suitable, and we are now offering prenatal care in a group setting. We've been doing this for a year. We're learning a lot. I think there's great potential, but we do agree about a lot of goals, like increasing, the breastfeeding rates, doing more preventative care, relationship building, risk screening, and eventually offering choice of birthplace.
The Norway House Health Division has several partners that are involved in the delivery of health and wellness services in the community and outside of the community. The federal government is our primary partner, but the provincial government also plays a significant role in the delivery of health services in Norway House. They're involved through the Manitoba Renal Program in delivering dialysis services in Norway House. They also play a key role in the midwifery program that we have in place, and they play a vital role through Pinawachi Personal Care Home, as they are the licensing body of the personal care home. We continue to build those relationships with both the federal and provincial government as we look to expand health and wellness services in Norway House. One of our key challenges right now is the health infrastructure piece, which we're working hard with the federal government to address. And we're currently going through a functional planning process to look at the design and development of a new health center of excellence in Norway House. And our goal is to have a new facility built in Norway House over the next 2 years to address some of our health infrastructure challenges that we're currently facing.
Moving forward and trying to obtain our goal of the new Norway House Health Center of Excellence is going to take some more work and some more advocating at the provincial and federal levels. And I think that once we do that, I think this new Health Center of Excellence is going to be one of the great accomplishments of the Chief and Council and the community and all our frontline workers. The end is in sight. We're going to keep working hard until we obtain that goal, that we have the proper home care and health care under one roof for our Cree Nation for the future. Nhcn.